Welcome to Biology Made Easy. Today we are discussing blood vessels, specifically their musculature and implications of the type of musculature and design that the blood vessels have. Welcome. We will look at the artery, vein, and capillary in this lesson. Well, you have a mammal like this. We have a heart. The vessels that take blood away from the heart, that's the arteries, and the blood is under pressure. So you have blood in red, that's the arteries, they are blood under pressure and usually oxygenated. Then you have veins, they carry blood from the body to the heart and they carry blood at low pressure to the heart. Then you have the capillaries that find themselves between the artery and the vein. Well, in this drawing, you can see we have an artery. The artery divides into arterioles that are small arteries, and then the arterioles divide into capillaries. Well, this diagram will show it better. You have an artery. The artery divides into tiny vessels, arterioles. So this kidney here, I have this blood vessel divided into a number of arterioles, smaller vessels. And these arterioles will divide into capillaries. The capillaries will join together to form bigger vessels called venules. So this is one venule, and the venules will join together to form a vein. In today's lesson, we are concentrating on the artery, capillary, and the vein. Well, we'll look at a TS, a section through an artery, and then a section through the capillary, and a section through a vein. You see a artery, vein, capillaries. The artery and the veins, they have these tunica adventitia, that's collagen and elastic fibers that are tough and fibrous and protect the blood vessels. And then you have middle layer of muscle and elastic fibers in the artery and the vein. Then you have an inner endothelium, very thin epithelial cells. That's the inner one. Then you have these surrounding a space called lumen. So in the artery, you have a very large muscle and elastic fibers and a small lumen. In the vein, you have a smaller or thinner wall of muscle and fibers with a big lumen. In the capillary, you only have epithelial cells, one layer, and a small lumen. These structures, this musculature, has implications. That is what we are going to discuss. So to make it easy, I have a table here. I have a blood vessels here, the musculature, and the implications or the adaptations. So you have an artery. It has thick muscle walls with plenty of elastic fibers and a small lumen. So this is an artery. It has thick elastic wall. The implication is that the muscles contract, elastic fibers also contract and relax. So the thick elastic walls of the artery, one is that it contracts to squeeze blood and then it relaxes to allow blood to flow. Remember, the artery is receiving blood from the heart. So the muscle elastic fibers, they contract to squeeze blood, and when they relax, they allow blood to flow in. So they contract to squeeze blood and they relax to allow the blood to flow on. That is the purpose of the thick elastic fibers of arteries. So as they contract to squeeze blood and relax to allow blood to flow, they do that squeezing and relaxing in tandem with heartbeat contractions. So the heart beats, this heart will beat by contracting and pushes blood, and as it does that, the artery also contracts, relaxes, and pushes blood. So the blood goes in the arteries in surges in tandem with heartbeat as the heart contracts and pushes blood, relaxes. It is in the same way that the muscles and elastic fibers contract, squeeze blood, relax, allow blood to flow. Just like the heart will do it, And it does that so that the heart is not choked with blood and the blood vessels are not torn by high blood pressure. Very neat adaptation here. Then the arteries also have small lumen. The small lumen will resist wholesale flow of blood. If blood is flowing and the lumen is large, blood will flow in. But if the lumen is small, it resists how much blood is pumped on. And that is what happens. And then the small lumen and the thick muscle also protect the whole artery from collapsing under the high blood pressure. Now, what about veins? The vein has small, less elastic wall and a large lumen. Now, the veins collect blood that has gone through capillaries. You see, blood comes here with pressure and flows into these capillaries, and so the pressure falls and the blood will have to go through the veins back to the heart. So the blood pressure in the vein is low. So the vein has less muscle, less elastic and large lumen. This is to allow blood to flow easily. You see, blood to flow in easily with little resistance because it has a large lumen and the blood pressure is low. If it has thick, small lumen, then it will have to force, but it doesn't have the pressure. And then blood that has gone through capillaries has low pressure, come into the vein, low pressure. And look at the veins. There are some in the legs and all over the body. Imagine blood flowing from veins here and they are low pressure and they have to flow and get back to the heart to be pumped with pressure. So the veins, to allow blood to flow in one direction easily, has what is called non-return valves. So if this is a vein, the vein has these non-return valves. This is a valve. And blood flows in one direction. If blood wants to flow back, these valves will close. So these valves are called non-return valves. They are at various points of the vein. So if you have veins in the legs and these veins have non-return valves and the pressure is low, imagine the blood flowing against gravity. So in the lower parts of the body, the legs and the thighs, beside the vein having non-return valves, skeletal muscles in the legs and thighs contract to assist. So if these are skeletal muscles, these are skeletal muscles, that there's a vein in between. The skeletal muscles, they contract and relax. As they contract and relax, they push blood and assist blood in the veins to go up. So beside non-return valves, there are skeletal muscles in the leg and the thighs that contract and relax and push blood in the veins. Now, let's come to capillaries. What are their musculature and implications or adaptations? The capillaries are thin, only one epithelial cells thick, so only one layer of epithelial cells. This is a capillary, these are epithelial cells, this has a tiny lumen, and the whole capillary is delicate and small. You remember, these capillaries are nerve cells. So there are cells all over, and the capillaries are found. So if you have cells all over and the capillaries are thin and delicate, just as the cells are thin and delicate, so they fit in and will not bruise cells. And also because they are thin, delicate, and have very tiny lumen, substances flow slowly in the capillaries, very slowly, so that substances can easily diffuse in and out of the capillaries into the spaces between the cells. So that is their adaptation too. Well, this is a very short one. In our next lesson, we are going to look at blood vessels, not musculature, but we are going to look at size and pressure in the blood vessels and their implications. This time we'll talk about the arterioles and the venules. So if these lessons have been useful, please give us your like and kindly do subscribe. Thank you very much. Bye-bye.